Long, long ago, in a land far, far away, Cambridge, it was decreed by Ruth May that health workers across the land were to help patients to be happy ever after. Ruth cast a spell, and the fairy godmother of Northamptonshire and her helpers vowed to keep patients safe and reduce their suffering. The ambition was that preventable pressure ulcers would be banished from the kingdom of Northamptonshire forever. Our story begins at Cransley Hospice.
Hi there, my name is PUP, which stands for Pressure Ulcer Prevention. You might recognise me as you may have seen my picture above the hospital beds at Cransley Hospice. If you see me, that means that the patient is at risk of pressure ulcers and will need to be moved regularly and have other treatment.
On the next page, we get to meet our staff to find out what they have to say.
We've come a long way at Cransley Hospice to prevent and reduce pressure sores and adopt the principles of the SUSKIN. SUSKIN stands for Service, Skin, Keep Moving, Incontinence and Nutrition. The surface, it's important that the patient's on the right surface to meet their needs. What we mean by that is mattress and cushion. The skin stands for skin inspection, so you're keeping an eye on the skin of a patient. K is keep moving, and so we encourage patients to keep moving and change their position. Incontinence is I, so we're looking at the continence products that patients using and making sure that there's no increased moisture, just promoting regular visits to the toilet. And N is nutrition. So we're looking at ways we can give optimum nutrition for that individual patient. So it could be drinks, snacks, or just their regular meals.
To celebrate our success here at Cransley, we use the Safety Cross, which is basically a simple data collection tool. And this tool enables the staff to note the pressure ulcer incidents on a live performance. So therefore, we can work out whether we acquired the pressure ulcers here or whether they were acquired from elsewhere.
Our next chapter tells the story of our patient's experience.
Since he's been in hospital, he's had a few pressure sores. But basically what we do, the carers always bring attention that he has got a pressure sore. If it's a bad one, I'll call the district nurse out and they put a dressing on. And then just keep an eye on it. But we put cream on him. We don't use toilet paper. We always use wet wipes, which is better. To prevent the pressure sores, we turn him regularly. Sometimes he's laid on his side, on his back. Also, we put him in his wheelchair, which obviously sits him in a different position. He's got obviously a soft cushion for that. And we've also had him in the chair, an ordinary sitting chair with a cushion underneath him, which also helps alleviate the pressure.
They turn me that way and then they lift my legs and then I get oiled on the elbow as well. I've got no problem with a pressure point at all, and I've basically been in bed for 5 weeks now and there's been no problems.
This is the story so far, but what is the next chapter? We have made so much progress here at Cransley Hospice that we now want to spread this magic to other parts of the trust. This will be our priority for the future, to spread health and happiness throughout the land.